In our last discussion, we discussed how the primary role of the lungs was to promote gas exchange. The primary role of red blood cells is to carry oxygen. And what you can see in this picture is these discs, these biconcave discs. They look like inner tubes that carry oxygen. These are your red blood cells. When you have discs that are misshapen, they don't have as much surface area to carry oxygen. People who suffer from sickle cell anemia have distorted red blood cells that have less surface area to carry oxygen throughout the body and to the tissues, and it can be quite painful at times. Individuals who suffer from asthma have narrowed airways because of bronchial smooth muscle constriction, increased inflammation, and an increase in production of mucus within the lungs. When you compare the airway of a patient or an individual who has asthma, you can see the normal airway on the left, the tube is wide open. Air can freely flow in and out of the lungs. When a patient who suffers from asthma has an attack or even a severe attack, what you'll notice is that the airway becomes more and more narrow. Either the muscles squeeze the tube to become more narrow, the inflammation of the tissue swells, and then mucus starts to accumulate, all contributing to the narrowing of the airway, causing difficulty breathing. Asthma is common in children and can be caused by allergic reactions that lead to the airway inflammation, the smooth muscle constriction, and secretions that narrow the airway. Oftentimes, the whistling that's heard when patients breathe is called wheezing. COPD is another lung disease, and the name stands for chronic obstructive pulmonary disease. Most people get this disease because of smoking, but there are other ways that individuals get COPD. Now, COPD comprises of two different types: emphysema, which is like an air-trapping disease, and chronic bronchitis, which produces a lot of mucus. Emphysema impacts the far reaches of the airway, causing dilation of alveolar structures, meaning those alveolar structures open up like a cave, and they're very pliable. The form called chronic bronchitis creates a lot of inflammation, tightens the airways just like asthma, and produces a lot of secretions. In both instances, you may have some of the same manifestations: smooth muscle constriction, increased mucus production, and inflammation. Now, again, the locations of these two forms of COPD are something to consider. The alveolar units are at the end of the lungs, at the tips of the lungs. The bronchial tubes are the tubes that conduct air to the alveoli. Some individuals are born with lung disease, and this is really sad. They are born with a condition that makes the mucus in their lungs very thick and very sticky. So this sticky mucus is very hard to cough out. And there are other conditions that affect patients who suffer from cystic fibrosis. But with lung disease, this sticky mucus is hard to cough out, and individuals are more likely to have a lung infection as a result. Lung cancer is another disease of the lungs where the cells within the lungs start to change, and they replicate in a new way that's not normal to the lung tissue. And with any disruption of lung tissue, there's a disruption in gas exchange. Remember, the primary role of the lung is to exchange oxygen for carbon dioxide. So when you have a disease of the lung, even cancer of the lung, then gas exchange can be impaired or blocked or slowed. So lung cancer can start in one area of the lung and grow and grow and grow to other areas of the lung. Well, after gas exchange, your blood has got to pass through tubes. Sometimes your tubes get sick, and this is called atherosclerosis. So sclerotic vessels get sticky and narrow when plaque starts to grow within the walls of the vessels. That's your artery or even your veins. But the buildup of plaque because of atherosclerosis can cause less blood flow to vital parts of the body. And if this occurs, you can become sick or ill or just feel very bad. So, atherosclerosis is where you have added plaque onto the inner wall of the blood vessel, leading to decreased blood flow.